Hi, it's Rebecca Kelly, nurse practitioner at Ayana Aesthetics. It's Tuesday Talk, and today we're talking about Botox and fillers. So I wanted to hop on here and kind of get into a little bit of a deeper discussion in regards to Botox and fillers, because it certainly is something that a lot of people are, confused or not really sure what the difference is between the two. And when I do my new client consults, I am explaining the difference between the two because sometimes they get interchanged. And so I want to just clear that up. So Botox or Dysport or Xeomin, there are a few out on the market. They are also called neurotoxins or neuromodulators, and what they do is they actually relax the muscle once they're injected into the muscle. So what does that mean exactly? So when the mechanism of action for Botox is that it essentially blocks that receptor and doesn't allow that chemical receptor to go ahead and bind. And by doing so, it allows the muscle to not contract or to relax. And when that muscle relaxes, you're not able to make those certain movements, like when you're trying to raise your eyebrows or scowl, because those muscles have been relaxed. That's what Botox does. Botox or, any of the other ones that are on the market. They are essentially a wrinkle relaxer. So sometimes people will come in and at rest, they still have those specific lines, whether scowl lines or forehead lines, crow's feet around the eyes, even when they're not making that muscle contraction. And what that is from is essentially from those muscles making that contraction over time, usually years. And so then the skin starts to fold in that direction. And so when I have clients come in who are already to that level of a wrinkle, it's called a deep wrinkle, it's going to take multiple treatments using Botox or similar to really smooth out the skin. And that just means that, getting your Botox or Dysport or whatever treatment consistently every 3 to 4 months over probably the next 6 months to a year, along with using skincare or other, treatments for the skin, such as microneedling, microdermabrasion, peels. All those will help expedite softening that line. But if they're already set in when you're just at rest, it does take a little bit longer for them to go away. We also do have a lot of younger clientele coming in, and they are wanting to prevent ever having those lines at rest. So they are getting Botox earlier, like in their 20s, which is a great thing to do. And we do see that a lot with our younger clients, because they do want to prevent those lines from ever setting in. So that is Botox or similar, kind of a condensed version. So what exactly is filler? So I always like to explain filler as a volumizer. So as we age, we lose volume in certain areas of our face. Mainly the mid face is one that's very much suffering from that volume loss. And what happens is that the fat pads that we have in our mid face, as we age, they get smaller, but then they also start to droop. And by doing that, you then start to get heaviness on your nasolabial folds. Also, in your jawline or pre-jowl area, you kind of start to see how the skin starts to kind of go in more, and also just kind of start to sag more. And that's where we get the jowls and the sagging of the skin, because we're really losing the volume in the mid face. So when we think of a filler, we'd want to add filler into certain areas in the mid face that are going to, one, give you a lift, just a little subtle lift, but then also add volume, because you start to flatten out in these areas, especially right here in the mid face, where we have those nice youthful cheeks. As we're younger, they start to just kind of flatten out and droop. So we add filler into the mid face to give it a lift and some volume. Other areas that are treated with filler, sometimes we'll fill in these nasolabial folds just to soften them a bit. If you look at your kids or other kids, you'll see that they still have those nasolabial folds. They might not just be as elongated down the face. We also get what these are called marionettes, and we can fill in those areas. We can do lip filler, which lip filler, I want to do another video on this and go into a little bit more depth. There's multiple reasons to get lip filler. It's not always just to plump the lips. It actually can kind of help with those lip lines too. So filler adds volume, Botox or similar relaxes wrinkles. So just in short, I wanted to let you all know about that. Be sure to like this video, subscribe so that you get updates, and we hope to see you at Iona soon.